So my project is on Dandy, and I am diagnosing him, and I've already diagnosed him, and now I'm going to be treating him. So Dandy Mott is a rich boy that is constantly spoiled by his mother, Gloria. His father was never in his life, and his maid Dora was the one that raised him, as Gloria watched Dandy grow. Dandy's psychological issues began when he tortured and killed cats, which is traits of a sociopath, and when he started experiencing symptoms of the Peter Pan syndrome, drinking out of a glass baby bottle. Danny was seeking some sort of belonging with the society he lived in, and he found that in the freak show. He demanded to be a part of it, even though he showed no physical disabilities. He later killed everyone in the show after they refused to respect and accept him. So, just kind of like his diagnosis I did before, sociopath, antisocial personality disorder, narcissist, and Peter Pan syndrome. So a sociopath is prone to emotional outbursts and fits of rage, constant aggression, and pathological lying. And I have a video here kind of going into more detail of a sociopath, and it just kind of describes it, and the Joker is a very well-known sociopath. So sociopath treatments: confronting the problem head-on, understanding the nature of a sociopath and acknowledging its complex traits, and dealing with the whole rather than with the little parts. So accepting that you're a sociopath, and instead of focusing on just little parts of fixing yourself, if you go to the problem head-on and try to fix it, it helps. Adapting a systematic approach. Treatments have a better chance of working if it's done in every system in which a sociopath functions, like his relationships with someone else, work, or activities. Psychotherapy, which is very common. It focuses on behavior change and skill building and is prominent with the disorder. Psychotherapy treatment tends to focus on teaching behaviors that are prosocial, using a combination of behavior therapy, cognitive behavior therapy, and personality reconstruction techniques. Some more treatments for a sociopath is medication. The use of medication in a treatment of a sociopath is minimally effective, yet because sociopaths usually experience other disorders like depression, paranoia, or anxiety, medications are usually useful in reducing these additional problems. And I did some research to help find some medications used for anxiety or depression, and for depressions, antidepressants, which is very common, SSRI, and for anxiety, I'm not going to be able to pronounce it, I'm not even going to try. Anger management also helps because a sociopath, as I said before, is extremely aggressive. So aggression towards is often present in a sociopath. And the American Psychological Association indicates that anger management programs offer a means for identifying the connection between emotional states and behavior through teaching consequences of actions. This form of treatment targets violence reduction in order to prevent the violation of rights of others. Sociopath treatments continue. There's really no cure for a sociopath, but it can be managed, like what I went over before, the medication for depression or anxiety or anger management. That helps with kind of like what goes along with being a sociopath, but it doesn't cure it totally. And the treatment is lifelong. You can't really completely rid yourself of this condition. Medications and therapy can help subdue it, though. Anti-personality disorder, which is you don't really care about anyone or anything else but yourself. You fail to conform to social norms, lack of remorse and anger. And again, I have another video here to help kind of go into more detail. Treatment for antisocial personality disorder is cognitive therapy. This sets guidelines for patient involvement, including regular attendance, active participation, and complex of any other necessary work outside of office visits. Major goal is to help the patient understand how he creates his own problems and how his disorder, like distorted perception, prevented himself from seeing the way others see him. There's really no medication used specifically for this disorder, like sociopath, but there are drugs that can help with the common problems also found, like lithium carbonate, which is found to reduce anger and threatening behavior. That could also be used to help with a sociopath, and whatever that is. It's been shown to reduce impulsive aggression. And you can see my picture down there is of a guy wearing a horse mask, and kind of like inferred from that he failed to conform to social norms, and that's why he's wearing a horse mask. Therapies also help. Family therapies help the families resolve the problems, because if somebody has this disorder, that can kind of like become a problem with the family and worsen the problem. Behavior therapy focuses on modifying harmful behaviors associated with psychological distress. And again, psychotherapy, really common, treatment of mental or behavior disorders through talk therapy. And once again, these treatments are lifelong. You can't rid yourself of this disorder, but you can kind of help it and keep it under control for at least a while you continue the drugs and therapy. He is a narcissist, which is people who have an inflated sense of their own importance, deep need for admiration, and lack of empathy for others. Narcissist treatment, psychotherapy. Treatment for narcissist personality disorder is centered around talk therapy. This can help you by learning to relate to others, so your relationships are more intimate and enjoyable and rewarding. And if you learn to relate to others better, you will become more nice to them and relate better to them. Understand the cause of your emotions and what drives you to compete, to distrust others, and perhaps despise yourself or others. It's more of not despising yourself. If you're a narcissist, you have an inflated sense of yourself, but you could despise others that seem to do better than you in life. There's no medications for this treatment, once again, but there are medications that can help you, and medications for anxiety or depression may be helpful, which I already went over that, so I'm not going to go over it again. This therapy may take several years. Areas of change are directed at helping you accept responsibility and learning to accept and maintain real personal relationships and collaborate with coworkers. If you're a narcissist, you may not work well with others, and this could be very helpful. Recognize and accept your actual competence and potential so you can tolerate criticisms or failures. And narcissists do not accept criticisms very well. Dandy in the American Horror Story killed people when they criticized him. Increase your ability to understand and regulate your feelings, and release your desires for unattainable goals and ideal conditions, and gain an acceptance of what's attainable and what you can accomplish. For example, Dandy wanted the twins in American Horror Story, yet it was kind of an unattainable goal because it was clear they were not into him because they killed him. Okay, Peter Pan syndrome. This is someone who is unable to grow into maturity, chooses to hang on to their childhood, and avoidance of assuming responsibility. Peter Pan syndrome, it's not yet recognized as a psychological disorder. There's no defined treatments, it's just a syndrome. Therapies such as wildness therapy, which covers psychodrama, cognitive behavioral therapy, strength-based therapy, solution-focused therapy, which is extremely important, and transpersonal counseling in family therapy. The healing sound of silence. This is where an individual is kept away from refocusing on things that will lead to addiction, like watching TV, computer games, internet, alcohol, drug abuse, all that fun stuff. Instead, they're focused on the real issue about themselves, and they start with the basics on how to learn to face the real problems in life. Like, people with Peter Pan syndrome tend to avoid problems, and this kind of forces them to go into problems head on and figure out themselves. Embracing the 12-step philosophies, this is a wilderness expedition where they go out camping and hiking in 4 cycles, in which they learn to share their experiences and prepare themselves for the next tour. 112 Philosophies is a program that covers meetings in the field camp and in communities. For them to be able to recognize support systems and availability during the 12 Steps program, they must be aware of the consequences of their actions and don't focus on themselves. They also learn to care and eventually realize that every individual in the group is a part of the whole system. Peter Pan syndrome is still a psychological issue. There is no established or exact measure of the individual's life expectancy. The cure for someone with this disorder is still unknown, yet there's different measures you can take to help subdue the side effects. And in this picture I have right here, it's a picture of a baby on a man's body because men act like babies. I just thought it was funny. This is more information. This document is information on the treatment, and the document below is information on the diagnosis and the disorders themselves, and then my sources.